share my screen. Okie dokie. So you should see a blue screen that says Public Sector Lunch and Learn. Nice. Okay.
Yep.
I'll get going then. Okay, so my name's quick introduction to me for people who don't know. I'm Jacinta Mellinger. I'm a service designer and Northern Beach dweller. I joined And Digital around, I think it's close to 2 months now. And before that, I worked in various local and central government departments as a service designer, both as a civil servant and as a contractor. I live on the northwest coast, so hence my title, my And title, and I live with my daughter and a very demanding cat that might appear and bite me at any moment. So sorry about that if she does. So if you could, there's probably not time for lots of like introductions, but if you're kind of, if you could type your job title, which club you work in and why you wanted to attend this lunch and learn in the chat, that'd be great. Also contribute to this however you are most comfortable contributing, but I may have to answer things that are in the chat after the session due to time. But it'd be great to hear your thoughts and your on this as well. Also, feel free to turn your cameras off and just eat lunch and listen. So a very quick recap on last session. So last time we went through the stages of the policy cycle in terms of understanding the issue, developing and appraising options, implementing and monitoring policy, and then evaluating and adapting it, and what policymakers might be doing at each of those stages. Then we went on to the design cycle and did the same basically. So I went through each stage of discovery, alpha, beta, and live, and what UCD practitioners might be doing as well. And then we discussed some key similarities and differences between policymakers and user-centered design. So one of the broader similarities was we were both trying to understand the problem better in some way, but we used very different tools and techniques to do that. We were both spending time carefully defining our problem space and what is in and out of our scope. We're both exploring and testing different options, but again, using very different sort of methodologies to do that. And then we went on to discuss the types of scenarios that you might encounter when working with policy and ways that you might be able to help at different points in the policy cycle. So when policymakers are trying to understand the issue, we might be helping to understand and define a problem space there through research and design. When we're into sort of the policy phase of developing and appraising options, UCD practitioners might be working on a zoomed out problem, prototyping and testing full service ideas, or showing how something could work radically better in the future. Sort of in between the develop and appraise option stage and actually implementing and delivering a policy intent, we might be helping to shape a whole service to deliver desired policy intent and intended outcomes for service users. Just before we get into kind of the implementation stage, there might be a need for user-centered design practitioners to help steer or redirect an existing project or to orientate it around a whole service. And further down the line, where there's more sort of definition for policy and there are product teams that are in delivery, we might be working to understand how that product fits within the wider service landscape and directly researching and prototyping and testing parts of the service. So that's what we did last session, but this one we're going to concentrate more on identifying constraints and building empathy, tools and techniques and helpful resources. So hopefully some of these tips will help you to prepare and help build positive relationships with policy colleagues. And some of them I wish I'd known kind of a very long time ago myself. So I'm really happy to sort of share some of this today. So the first tip is to understand your context and where you are in the policy cycle, as we discussed last time. So asking questions to understand this can help you to dig deeper into what your constraints are and how you can help. Tension, in the past I've seen tension created where user-centered design practitioners may not dig deep enough into this. So asking questions to get your scope and what you can challenge through evidence and what really is immovable for the stage that you're in can really help a lot. Policymakers can often be looking to user-centered design to see how they can best support them on problem justification or evidencing different options for delivery. Whereas user-centered design often, as we find out more in the discovery phase, we can start to challenge the problem definition as we find out more. And that's also kind of a stage that can cause a bit of tension. So it's good to sort of understand what's happened before in terms of where you are in the policy cycle, how much has been defined already. So a question I'm grappling with at the moment is how might we remain user-centered whilst taking into consideration the scale and complexity of work that's happened elsewhere. So it's a good one to sort of think about as you go into a project. So the best solution for the country. So this is referencing a conversation that I had with a policymaker, and I was trying to understand what they were ultimately trying to do in the first phases of understanding the issue and developing and appraising different options for policy. And they told me that they were trying to find the best solution for the country. So this sentence really made me think at the time, and I compared it to what I was trying to do as a service designer, which is kind of obviously trying to get to the best outcome for service users, and the difference between those two things. And this became quite sort of a deep and profound thing for me to puzzle over and give a lot of thought towards. But however, coming back to, I think it's really important to focus on what unites us as kind of people working within government. And what unites us is that we're both really working in a world of constraints and uncertainty, and trying to get to the best solution. So this led me to the question of how can designers learn and speak some policy language whilst keeping the experience of service users at the forefront of our work, because that's what motivates us basically. So some of the ways that I tackled this was thinking about if I could weave some kind of figures into my user journeys, or can I demonstrate that I'm ultimately saving money for government whilst improving user experience, and bringing in some of that economic impact and financial analysis that doesn't come naturally to me. For one, I don't know about others, but it made me realize, as well as talking to as many people about user-centered design as possible and helping people to understand what it is, I also need to adapt and keep learning about things that may make me as a service designer feel really uncomfortable. about at first, because it's brand new and it's something that doesn't maybe come naturally to me. But it's important to, sort of explore both sides of the coin rather than just educate about user-centered design. Your users have changed. So this refers to things can and will change overnight and frequently do around the scope of policy decisions, key decisions that will affect your projects. So you can imagine what this was like during COVID. When I worked at UK HSA, our context changed weekly and sometimes daily. Your users would change, your constraints would change. Sometimes you were told to stop completely and start again on something entirely different. The names of projects would change on a daily basis. And it was a bit dizzying at times, but I think that was an extreme experience of how changeable it can be. So policy can and sometimes needs to be really reactive. And that means user-centered design has to be flexible to change, whatever stage of design you might be in. So it requires a sort of developing a level of patience and being able to throw away things easily and adapt at any stage. So it's almost like holding your ideas very loosely in the knowledge that they could be thrown in the bin the next day. So tools and techniques. So now we're going to look at some different tools and techniques that you can use to collaborate with policy, depending on your context on a project or whereabouts you are in a policy cycle. So if we start with understanding the issue and developing and appraising different options. So here we're helping to understand and define the problem space, and we might be working on a very broad, zoomed out problem. So these are rare projects, but in some departments they're becoming a lot more common, and particularly Department for Education is a bit ahead of the game here in the way that they form their teams and have service owners to make sure that there is this space where we kind of collaborate quite closely with policy up front. So you'd often be sitting in a policy lab space or an innovation space, but it can sometimes happen on product teams as well. So you'll be working with policymakers, economists, social researchers, as well as your design team. And some examples might be to talk about like the size of the problem that you might be working on in this stage. It might be as big as how can we reimagine adult social care services for the elderly, or how might we improve access to low-level mental health care services. So it's big, weighty kind of questions. So the scope is broad, and there's potentially at this stage no business case or no funding agreed. So it's kind of a space where you can really explore, and there might be an opportunity to either shape the 3 options for appraisal or to support policy to narrow down its focus onto the best option to take into delivery. Or it might be through kind of prototyping and testing services quickly and cheaply, for instance, to help refine and iterate the design or key decisions before it goes anywhere near a delivery space. So it's quite an enjoyable space to be in terms of your constraints as a designer might be very few at this stage. So there's obviously lots of tools and techniques, but I'm just going to talk about 3 of them today that are quite common. So many tools and techniques that we use in this space put an emphasis on ways to improve understanding, collaboration, and sharing power with service users. regarding decisions that affect their lives. So one, which is more in the user research type of discipline, is ethnography. So at the moment, and for quite a few years now, Policy Lab have hired ethnographers who spend hundreds of hours documenting and sharing people's day-to-day experiences of government services. And they use film and photographs and audio recordings or anything that helps them capture that experience. So most recently, they've documented the experience of families of children who receive social care services and their experiences. So the benefit of this technique is in the power of storytelling to influence change. So it's where you can gain a deeper understanding of the why. So policymakers might be dealing with lots of figures, lots of social research, lots of behavioural insights, lots of academic think tank type information. But this kind of ethnography can really help you to understand the context or the why around a problem, rather than just what's happening. The second is co-design. So this involves creating spaces for people who play a variety of roles in policy, in a policy space, to come together and basically share mutual experiences and decision making. So this could include people with lived experience of a problem, professionals who deliver services to those people, key decision makers who have power to bring change to that service, and more importantly, it results in something tangible, whether that be a campaign, a product, a service, a movement, a support group, or basically something happens because of it. And it also involves some kind of value exchange, so people are recognised for their time and their contributions in some way, whether this be financially or otherwise. So an example of this is, whilst I was working on the health and benefits service for DWP, we invited benefits claimants, we invited job centre staff, we invited medical receptionists, and even managed to get a doctor there. We got citizens' advice and the health insurance companies who conducted the health assessments all together in one room to map out their experiences, their processes and their pain points from all of those different angles together. And then we created some sort of common problem statements that we could work on together, and generated some ideas and prototypes around what that group thought were most important, what that group thought were the most important problems to solve. The third kind of technique is whole service prototyping. So this is used to build out and test an idea to deliver a policy intent in a more holistic sense. So techniques you could use are things like storyboarding or service walkthroughs, or, as this picture shows, sort of very low fidelity prototypes. Also role play. And it's used to design something very quickly and cheaply that helps you test out a very basic idea, but fast, so you could throw this away quite quickly as well. So an example of this in action is the yearly Global GovJam, which is a voluntary design event for anyone that guides participants through the process of designing and testing out new service ideas. So this pic is a model of a new service for veterans created at Blackpool GovJam. And the aim was to help veterans claim 100% of their compensation and not have to use expensive third parties to do this on their behalf. And this was the veteran team made a model of how this could be achieved, as you can see, using lots of various materials, lots of different channels, and we're able to take this out onto the streets and sort of test it with people and see what they thought of the idea. So it's very fast, very cheap, very immediate way of testing kind of service ideas. So I'd like to ask the group now, because that's been a whole lot of me talking. Has anyone had any experience of using any of these techniques before, or learned about anything around these techniques that's made them ask questions or in the past? No.
I've just done some stuff with the co-design around. It was when I was at Hackney Council Centre, and it was during, it wasn't COVID time, it was before COVID, but basically it was involving policy colleagues and how in particular the council can look at supporting young black men within the borough. So Hackney, one of the most diverse parts of London, and it was one of those, the outcomes of young black men in the borough in terms of education, employment, training, things like that, statistically lower. And actually what they ended up doing was working with us in the kind of the IT designy type space, along with their representatives from young black men within the borough, as well as the policy colleagues, to come up with ideas about how to maybe support in that area. So that was quite interesting kind of thing. I mean, the thing was, there was a couple of boards and a couple of groups that then CAPA set up after that to kind of pull through some of the ideas that came through. And we ran out and tested them on the streets with people as well. So that was one thing around that kind of the co-design space that was good fun, actually.
Yeah, I really enjoyed the GovJam work as well, because it's so immediate, isn't it? It's so like you're going through the design process with a really varied group of people who may not have experienced anything in that area at all. And it's just so, I don't know, there seems to be a lot of value in kind of including kind of decision makers in that as well, and people who, you know, can actually make those changes. And the more that they're involved in that, somehow the stronger the messages come through. Yeah.
Totally.
So anyone else, or should I? Oh, we've got some hands raised. Debbie?
Yeah, this wasn't public sector, this was private sector, but we did some work in Kilburn for Newmark Digital, which is pharmacies. So we were looking at the dispensing process for medicines when patients order them, and we went into lots of different pharmacies. So we did some ethnography with them and spent days there looking at their actual job and what they did and all the different systems and how they moved around different spaces, because we were going to be giving them another thing to do as part of that service. And then we got them into the depot and did some co-design with them, and we had it on the walls on brown paper, and we walked them through the different screens and what they would be doing and the things to look out for. And we, from doing that, we found out how badly they would use what we were going to put together. So we had to have some compromises, because when they were going through, they'd be like, oh great, we could do that, or one of the things was we found out that they would never use their own login details. One person put their card in so they could get hooked up to the NHS Spine, and everyone else would use that login, so they wouldn't be able to track individual users and things like that. So it was really interesting. We would never have found that out if we hadn't have done those sessions.
It's the sort of immediacy of it, isn't it? And there's something like powerful about doing that before you go into like an implementation.
Yeah, it was all paper. At this point it was paper prototypes and paper on the wall, and we walked through and we were able to make decisions without it having been built and knowing what our risks were.
That's cool, thank you. And Chris?
Yeah, I'm not sure it's an example. It's not an example, so it's just a thought that's buzzing around in my head. It'd be interesting to get people's opinions on it, which is in some way, I think there's an opportunity almost for a plan for a plan, right? So how do we get engaged? And as we engage with the policy people, we actually find out they need more. And I guess just some of the bigger policy ideas, almost digital engagement to test some of those policy ideas is something that people are looking at. You know, so how do I really amplify or extend the feedback? Almost but going through that, we almost identify opportunities, I guess, to say, well, how can we engage with people to test the ideas? And I've seen it more internal policy. So I've seen people use tools, for example, where you sort of these bias models where you're saying, well, would you rather have, you know, in HR policy, do you want 5 weeks of holiday, or do you want 4 weeks of holiday and some more money type stuff, right? But you can, I guess, to the point as you go through this, almost you find an opportunity to say, could we go and find new ways of asking the question with those people who will actually be impacted?
Yeah, 100%. And it's kind of, I suppose, getting into that area, I suppose what I've found from being a service designer is it's really rare still to be able to be in that opportunity space to help kind of policy develop a whole service offer, rather than it be passed on to, you know, the problem or the delivery or implementation of something be passed on to us as almost like a piece of IT to deliver. So we want digital to do our application form, and that's their bit. And it's kind of, it's almost like bringing those, almost in the same way that we iterate our digital prototypes quite, you know, instantly we're trying to look for somebody's response and make changes to it, and it's very smooth. And in the same way we can like iterate, there's an opportunity here to iterate policy in the same sense, and to understand how digital fits into whole service environments, rather than it being an afterthought in a way, or a thing that helps you to do a very specific, almost like boring task. And how does that all kind of mold together to make a coherent service offer is kind of the thing that would, you know, that gives me the most like job satisfaction in a way. So any other hands up? Don't think so. Okay, we'll move on. So some resources here are, one of the best resources to support you to work with policy is the Open Policy Making Toolkit. So it's kind of a service manual for collaborating with policy that guides you through each stage with ideas and methods. So as well as the toolkit, Policy Lab have just launched some really useful experimental cards, and they've got some interesting techniques for collaborating with policymakers. This is Service Design Doing, is a book that I'd recommend that has some great step-by-step practical advice on how to conduct various types of ethnographic research and service prototyping. And I think a book that's really inspired me is around what's actually possible in this space, is Hilary Cottam's Radical Help. So it's a book that talks about lots of different sort of case studies using ethnographic techniques and new technologies to enable more effective services. And it kind of really blends those two worlds together in a really nice way to illustrate how digital is used as an enabler rather than a solution to government services. And the last thing that another book that I'd recommend is Kellyanne McKercher's Beyond Sticky Notes. And this is just a really nice guide to co-design, mindset and methods and it's got a really good quiz in it called But Is It Co-Design? And it's kind of questions that will help anyone on your team to understand if they're doing co-design or they're just doing it by name, if you know what I mean, not exploring it in the way that they could, because it's become quite a heavily misused term in public sector work, and there's quite a lot of damage that's done by not doing it in the best way. So I'd recommend that as well. The next part we're going to look into is the phase between sort of developing and appraising options and implementing. So here you may be helping to firm up an option to take into delivery. You could be supporting policy strategy and service owners to influence and define the full offer. You could be bringing key stakeholders on board and increasing shared understanding across departments in that way. Or sometimes also organisations across organisational boundaries to understand the problem space. You could also land slightly the other side of this early phase of implementation and have some kind of steering or redirecting work to do to help orient projects around an understanding and delivery of a whole service, or to help nurture a service mindset with your stakeholders. So, for example, how do we name the service in the best way so that our users can find it is kind of a very basic thing you can do, but it's also a really important part of creating a service mindset. So this is pretty common in my experience, sort of landing in this space, and it can involve lots of mapping, influencing, and evidencing work to really develop that service mindset with people. So post implementation, you could also, which is a lot more common, land into a product team mid-delivery and help them understand where their transaction fits within a wider service environment, directly researching, prototyping parts of it. You may have possibly less to do with policy at this stage as the scope's more defined, but you'll most likely need to work with them as you learn more about the problem space. So the more you do in discovery and the more research you have, you might need to go to policy to firm up or get clarity on your scope. So some of the tools and techniques that you could use in this stage are service communities, current and future state mapping, or outcomes mapping. So particularly to shape and define a service to deliver policy intent, you may need to develop service communities. So these are groups of people who represent a full end-to-end experience of a service. So they come together to map how whole services work. They identify shared problems and try and find solutions to those problems as a whole. So many government services you'll find can span departments, agencies, sometimes different sectors. They can have charities involved. And this means that a service user, to get to their ultimate end goal, whatever that may be, has to interact with all of these separate delivery organisations to get to their end goal. So, for example, to receive health-related benefits from DWP, you don't only have to interact with them, you would also have to interact with NHS, healthcare companies, citizens' advice, possibly the courts and tribunal service if you don't agree with your decision. So when we mapped this out, we found that there was so much more involved than just the job centre and DWP to actually help a service user get to their goal of receiving some benefits whilst they were sick. So we found that often these separate entities don't talk to each other or don't understand each other's processes. which means that service users easily fall through the cracks, or they don't reach their end goal, or they can reach their end goal, but they experience lots of pain and it takes lots of time to do that. So service communities are a way that they can support you to build relationships, identify shared problems and fix them together. But we do this ultimately so users can reach their goal more easily, but also policy intent can be realised as well. So current and future state mapping, let's check how much time we have left. Oh, we're okay. Current and future state mapping is, you can use this to help policy, service owners, senior leadership teams to analyse a current service offer. So that's identifying problems, what the problem results in terms of effectiveness and efficiencies, but also identifying the best place to fix it. So is that within the user experience and the front stage public facing service, or is it backstage in some kind of is it kind of a process or a technology, or it's basically saying that a digital product isn't always the answer, and we need to understand, by doing this bigger analysis, we can understand the best place to fix it. So it can also help service owners and delivery managers to understand the shape of the teams that they need to do the work, and who they need to work with to get key decisions made. Future state mapping as well can also help people to visualize how things could work completely differently, and it's often important to do this outside of your constraints in a way, because even if this is shrunk down to eventually include those constraints, it gives people and teams a picture of something to aim towards, or like a focus or a direction of how things could work entirely differently in the future, and this can bring about quite a lot of change within the team. So as a whole, these maps help us to understand where we fit within the service environment, and what our dependencies are, and who we need to align with to make that kind of service work. The final technique is outcomes mapping. So this is a helpful tool to help shape and define a future service offer as well, or challenge current processes. So that involves mapping the steps a user has to take to reach their end goal, and defining what a good outcome is for each type of user. So this is an example of an outcomes-based service map for the bereavement service, again at DWP, produced by Marie Cheng, who's a service designer that I worked with at the time. So as you can see, we've got the steps a bereaved person needs to take across the top. And then we've got the people that use the service and the people who deliver it as well. So we consider these as all, these are all our users along the side. And then we've tried to define what an ideal outcome might be for those users in each stage. And this helps us to kind of focus on what gets us closer to the mountain, or, you know, what gets us, the end user, closer to their goal, and the things that we might need to design and ideate around. This is an example of the Starter Business landscape map that was developed from the Starter Business service community. And it's just one example of an artifact that might be created within a service community to identify and map which departments or organisations deliver what along an end-to-end journey. And you can see it's very hard to read that actually, but don't bother trying to read that. but the general idea of it is there are lots of kind of different organisations that you may need to interact with to start your own business, and they all offer slightly different parts of the service delivery to get you to that end goal. So again, some resources. So we've got within the GDS service manual, there's GDS did a lot of development work around service communities a few years ago. It started around 2018. Sadly, the team aren't there anymore, but they've left some brilliant guidance on how to set up and run a successful service community within the service manual, and it's still there and very comprehensive and easy to follow. Marie Cheng did quite a few, created quite a few kind of tools and templates and resources for you to use to do outcome-based mapping, which I'd recommend. And I've just included a nice link to how to do service mapping there, but there's so much out there on this. It's really a matter of finding something that you find digestible, or your favorite resource that helps you to service map. So I've got some minutes in now. See what time we're on. Yeah, got some minutes to do a bit of discussion, or any questions or thoughts or comments that anyone might have around that subject. Or and it's okay if not, and you'd rather stop here, and I'll just send out the slides to everyone. No? Okay. Okay, I'll end there then. And thanks so much for joining me over lunch to do this.
That was great, Jacinta. Thank you very much. Please share the slides.
No problem at all. There's a bit more general reading at the end, and thanks so much. Thank you.
That's great. Thanks for running it.
Thanks for that, Jacinta. We've now got some time to go and read this stuff.
No problem. See you soon, everyone. Bye.
Bye. Thank you.